So we recently published our experience with the triple-negative myelofibrosis, or what's called triple-negative myelofibrosis. So that's a small subset of myelofibrosis patients, consistently been in the literature reported to be around 10% of the patients with myelofibrosis. And what we mean by triple-negative, it means they don't have any of the phenotype driver mutations, the JAK2, the calreticulin, or the MPL. And that group had been reported to have worse outcome in general. I think from my opinion, sometimes I question the diagnosis. Sometimes, like, those are the group that you want to make sure that they are not myelodysplastic syndrome with fibrosis. Their outcome is worse. Like, even today in the talk, I highlighted in Telestat data set that those patients actually seem that they drive survival advantage. In general, they correlated with more cytopenias, higher risk disease, and worse outcome. On the translational side, our group, Dr. Yoon, had been looking also in this group of triple negative about a pathway that's overactivated, and it seemed that the patients with triple negative were enriched with trisomy 8 as a cytogenetic abnormality, and maybe there is a role of c-MYC overexpression that could be in the future a target of therapy in patients with triple negative disease.